welcome. It's Chris from Christopher Hole Training. Welcome to this week's tutorial where we're talking about low back pain causes, and we're going to be looking at the bigger picture, or the big picture, as I've mentioned. We are going to look at some, I guess you could say, more specifics, but we're going to look at a bigger picture, and hopefully it'll resonate with your low back pain, and you'll be able to figure some bits and pieces out, or at least add some pieces to the puzzle that is or that could be your low back pain. So what we're going to try and understand in this tutorial is the contributing factors causing low back pain. We're going to look at three different bullet points. So first of all, we're going to look at three different pain triggers. So that might be something that you already know of, or it might be something that you don't know of. Then we're going to look at what factors contribute to those pain triggers, because a lot of people might say that it's the pain trigger that's causing it, but then if we take it a step further, well, what's causing those pain triggers? We can then take it further than that, but then that requires a little bit more in the way of specific information, and there's quite a lot of that specific information, so I won't go into that right now. And then finally, we're going to look at, well, how can we overcome that? So how can we start correcting and start reversing this low back pain, and how can we turn it around into a healthy and fit lower back? So that's what we're going to talk about today. But before we get into that, just want to quickly talk about my social media. Just quickly mention it. On Twitter, it's @ChristopherHole. On Facebook, it's Christopher Hole Training. And Instagram, it's Christopher Hole. So please do come along there, like and follow. I'm sharing more information like this. Alternatively, you can come to the website, which is ChristopherHoleTraining.com. If you follow this link down here, you can go straight to my free guide or micro workout, which is the 2 best stretches and exercises for low back pain. So you get 2 stretches, 2 exercises that I commonly use with people that are experiencing lower back pain, and they will start to help you, let's just say, correct the problem and start moving you in the direction of overcoming your low back pain. Off the back of that, you also get 2 follow-up videos, one on day 5 and one on day 10, after you get the free download. So all you do, enter your name and email address, download the 2 best stretches and exercises for low back pain. 5 days later, you'll get 1 video. 10 days later, you'll get another follow-up video, which will help you get more from the micro workout that you can start doing. All the guidelines are in there of when you need to do them, how you need to do them, how long you need to do them, the different reps and sets and things like that. So all that's in there, so you can just go along and find out more about that. So what we are going to be talking about is lower back pain causes, and we're going to be focusing on the bigger picture. On this first slide, we're going to be looking at the 3 pain triggers that I mentioned. Now, these are probably the most common ones that I work with. So we've got muscle tension / joint stiffness, we've got trigger points, and we've got the nucleus pulpus touching a nerve. So essentially, when we're talking about muscle tension and joint stiffness, what I tend to find is it's in this area here of the lower back. Now, that doesn't necessarily mean making these joints more flexible, but what we certainly want to be thinking about is relieving the tension in the psoas muscle, which you can see here, and you can see it joins onto the 5 lumbar vertebrae, and we got that first one there as well. You've also got the QL, which joins the pelvis, the lumbar spine, and the ribs together. So you've got the psoas, you've got the QL. To some degree, you'll have more hip muscles. You'll also have glute medius, glute minimus, but I'll come on to those in a second. But essentially, when it comes to muscle tension and joint stiffness, you could also have, as I'm there, you could have a rectus spinae going up the back as well. It's on the back of the pelvis. But yes, so with regards to muscle tension and stiffness, it's about bringing a little bit of relief to these muscles up through here, the QL up through here, so on and so forth. So we can use massage, we can use foam rolling, and we can use stretching to be able to do that. So when we're talking about a pain trigger, it could be that those muscles are becoming extra tensed, i.e. a back spasm. It could be that we're just sat down for a long period of time and the joint is just becoming a little bit stiffer. The muscles are becoming a little bit stiffer, and that's creating the pain as well. The second one is, so we've covered that one. The second one is trigger points. Now, trigger points can sort of give you low back pain, or you can experience low back pain from trigger points. So if we come over here, we've got the glute medius trigger points here. So you can see the three of them. You've got trigger point 1, furthest around the back, trigger point 2 in the middle, and then trigger point 3 there. Now, these are all in the glute medius. So if we go to trigger point 3, what you tend to find is if that trigger point becomes, let's just say, active, you'll experience pain right on the small part of your back. So what you would do is you would treat this trigger point here with massage or with foam rolling, and it would start to relieve the pain in here. If we go on to trigger point 2, it's not necessarily lower back, but it's sort of through the hips here, and it can potentially radiate down here, if that makes sense. And then trigger point 1 can go back sort of into the buttock and the small and lower part of the back. So you're kind of in this area, and it can radiate out here as well. So with regards to the first two, we can treat these quite simply with foam rolling, massage, stretching, so on and so forth. So it's a much more simple treatment for these types of causes of pain. Then we come on to something a little bit more serious, which does require a little bit more in the way of treatment. But essentially, we've got a herniated disc. So this is where this fluid on the inside of the disc comes through, touches a nerve, and triggers the pain. Now, there's not necessarily an exercise intervention that we would necessarily use for this one. You would probably be looking at more a surgical intervention, although there are certain things that can be done with regards to exercise in the way to minimizing your risk of it, but it can also sort of reverse itself as well. So with regards to the first 3 pain triggers, that's what those are. So maybe some of those resonate with you. What we're now going to start talking about is what causes these 3 pain triggers. So what is it? Because these don't just happen. They don't just one day just occur. That it happens over a period of time. So what we're going to discuss is what is potentially contributing to these 3 pain triggers. So this is the big picture that I was talking about. What's causing those pain triggers? So those 3 pain triggers we talked about, they're quite common when it comes to low back pain. So what we've got to think is, how are people getting to that point already? And essentially, it's these 3. It's dosage, so exercise dosage or activity dosage, or even stress dosage. So how much stress are you getting? Be it from just mental stress because you've got to hit deadlines at work, to exercise stress. So we're talking about the amount of exercise that you're doing there. So that's the amount there. Then we've got technique. So and this can also fall into posture as well. So we can also bring posture in. So this is more now about a quality. So how well are you moving? What's your exercise technique right? Is it adequate enough to minimize pressure on joints? So if we use a joint too much and we overdose exercise or activity on it, or we overstress on something, we're giving ourselves a high dosage of stress, be it a physical or a mental stress. If we then have poor technique and we have poor posture, or we're sat for long periods of time, then we're going to again be increasing the pressure on certain joints and on certain muscles. They're going to fatigue more, so on and so forth. Then what we get is the third thing, which is adequate rest. So if we've got a high dose of exercise, let's say, we're going to need a high dose of rest to go with it, rest and recovery. If we've got really poor technique, it's going to take longer to recover from. So we want to be decreasing the amount that we do, if that makes sense. So you can start to see all of these start impacting each other. So what we've got to do is we've got to reduce that. So as I've talked about here, I've explained over here. So you've got dosage, too much without adequate rest. So this is where you might think about, what have you been doing in the days leading up to your back pain? Is it because you were doing too much exercise, too much activity? Were you sat down for a long period of time? Because if you do too much, you wear your body out. You burn your body out if you don't rest enough. If you do too little, your body's not resilient enough to be able to cope with everyday life, if that makes sense. So you've got too much without adequate rest. You've got too little. Technique, which is a quality issue. So how well are you moving? Have you got poor posture? Is your exercise technique incorrect? Finally, you've got, which is probably the most common moment that people experience back pain, is lifting. So it's very important to improve your lifting technique. You want to have good posture through that. Because what all these three things are doing, if you haven't got them in this sweet spot, which is where they sort of overlap, which is where I would describe you have a healthy back, because you're creating that sweet spot, is you get little micro traumas. Now these are essentially, they're little micro injuries. So when you go and lift a box up once with bad technique and you don't feel your pain, you cause an injury, but the injury is so small that you don't feel it. But what happens is those injuries accumulate, the muscle might become dysfunctional, it might fatigue, the trigger points might occur with certain muscles, but essentially what's happening, it's the straw that broke the camel's back. So when you're talking about your low back pain, it's all these micro injuries accumulating all the way up, accumulating, and then it hits this ceiling, this limit, this what do they call it, tipping point, and then all of a sudden pain comes out. So it's not necessarily the one time where you were bent over incorrectly and your back went into spasm, or it wasn't the time when you were lifting a washing machine into the back of your car and then your disc herniated. It wasn't those single moments on their own. It was an accumulation of many different movements that add up, that then the pain comes out. So when we're talking about what causes those, it's dosage, it's technique, and it's making sure you have adequate rest. So it's those three then which are then the solution. Because if we can dose our exercise correctly, use a better technique, and have adequate rest, we are going to, and this is how I always describe it, we are going to minimize risk of injury. We'll never prevent it, but we can certainly minimize it. So by using things like I've mentioned before, massage, foam rolling, stretching, dosing your exercise correctly, using improved technique and better posture with adequate rest, we're going to minimize risk of injury in the future. So to summarize, which I've kind of done a couple of times already, what we really want to be focusing on is day-to-day life, because that's what's going to minimize the risk of injury. We're going to be thinking about every time we go down and lift a box from the floor, and saying that the more that we do this better dosage, this better technique, this better adequate rest, the better we can do that, the more margin for error you have when you use poor technique, when you go through a few days of having to sit in your car for 8 hours a day, or sit at your desk for 8 hours a day and not move. When you do this correctly most of the time, it allows you more margin to go and do poor things. If you do poor things all the time, then you're always at risk. But if you do the right thing 80% of the time, and then you do the wrong thing 20% of the time, you're going to survive that 20% a lot more than if you don't, if that makes sense. So that's kind of what I mean by the bigger picture. We're not thinking about those specific little movements that you do when you experience the pain. We're thinking about those specific little moments that you do when you don't feel the pain. Because what most people think is that's not causing the problem. They think they're fine then. They think they're healthy then, but they're not. Because health is a habit. Health is an action, and we have to make sure those actions and those behaviors match what healthy lifting is, or healthy technique, or healthy posture is, what healthy dosage is, and a healthy amount of rest as well. So hopefully that's giving you a better idea as to what is potentially contributing and causing your low back pain, but thinking about it from a much bigger perspective as well, and thinking at it from a slightly different angle. So many thanks for watching. My name is Chris, and I'll speak to you in the next tutorial.